Hi everybody, I am going to talk about the learning disabilities. Learning disability or specific developmental disorder is a disorder that inhibits or interferes with the skills of learning. Learning disabilities are life disabilities and they are seen in children as well as in adults. The impairment may be so subtle that it may go undetected throughout the life. These disabilities create a gap between the true potential and day-to-day performance. They interfere with academic skills such as reading, writing, and arithmetic, as well as activities such as games or personal skills like getting dressed up, keeping the room tidy, and other aspects of life. If an individual does not benefit from a regular education program, or if he or she is not intellectually limited or pedagogically deprived and not socially disadvantaged, and shows no evidence for hard sign of any neurophysiological dysfunction, then that individual is identified as learning disabled. Given the magnitude of the problem, it is important that persons with a learning disability must receive greater socio-economic and political attention. At the end of this talk, you will gain an adequate knowledge about the meaning and nature of learning disabilities, know the types of learning disabilities, understand the etiological factors of learning disabilities, and learn the strategies of intervention for learning disabilities. Let me discuss about the meaning and nature of learning disability. Learning is acquisition of new knowledge, skills, or attitude. Children during their early years of development learn to understand the spoken language first and then learn to speak. Subsequently, during their school year, children learn to read, write, and do arithmetic according to their age and intellectual capacity. But some children may not be able to learn one or more of these skills as per their age and intellectual capacity. There are some children who, in spite of having average intelligence or above and with normal visual or physical abilities, are unable to acquire one or more age-appropriate learning. These children have specific learning disability. No other disabling condition affects so many people and yet has such a low public profile and low level of understanding as specific learning disability. Specific learning disabilities are neurologically based processing problems. These processing problems can interfere with learning basic skills such as reading, writing, mathematics, and difficulties in motor coordination. They can also interfere with higher level skills such as organization, time planning, abstract reasoning, long or short term memory, and attention. It is important to realize that learning disabilities can affect an individual's life beyond academics and have an impact on relationship with family, friends, and in the workplace. Let me now give the meaning of the word learning disability. The American Special Education Law, the Individuals with Disabilities Education Act 2002, defines a specific learning disability as a disorder in one or more of the basic psychological processes involved in understanding or in using language, spoken or written, that may manifest itself in an imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations, including conditions such as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. Learning disabilities should not be confused with learning problems, which are primarily the result of visual, hearing, motor disabilities, mental retardation, emotional disturbance, environmental, cultural, or economic disadvantages. Generally speaking, people with learning disabilities are of average or above average intelligence. There often appears to be a gap between the individual's potential and actual achievement. That is why learning disabilities are referred to as hidden disabilities. The person looks perfectly normal and seems to be a very bright and intelligent person, yet may be unable to demonstrate the level of skill expected from someone of a similar age. Learning disability is an umbrella term describing a number of other more specific learning disabilities. There are certain types of learning disabilities known as dyslexia, dysgraphia, dyscalculia, and dyspraxia. Let me now explain each of these learning disabilities. Dyslexia is a specific learning disability that affects reading and related language-based processing skills. There are a number of different definitions and descriptions of dyslexia, which may be appropriate for certain contexts or purposes. In 2009, Sir Jim Rowe's report on identifying and teaching children and young people with dyslexia and literacy difficulties gave the description of dyslexia as a learning difficulty that primarily affects the skills involved in accurate and fluent word reading and spelling. Characteristic features of dyslexia are difficulties in phonological awareness, verbal memory, and verbal processing speed. Dyslexia occurs across the range of intellectual abilities. It is best thought of as a continuum, not a distinct category, and there are no clear cut-off points. Co-occurring difficulties may be seen in aspects of language, motor coordination, mental calculation, concentration, and personal organization, but these are not by themselves markers of dyslexia. A good indication of the severity and persistence of dyslexic difficulties can be gained by examining how the individual responds or has responded to well-founded intervention. Let me outline the signs and symptoms of dyslexia. The person with dyslexia reads slowly and painfully, experiences decoding errors, especially with the order of letters, shows wide disparity between listening comprehension and reading, has trouble with spelling, may have difficulty with handwriting, exhibits difficulty recalling known words, has difficulty with written language, and may experience difficulty with mathematical computations. Let me mention the strategies for intervention. The educators and parents should provide a quiet area for activities like reading, answering comprehension questions, use books on tape, use books with large print and big spaces between lines, provide a copy of lecture notes, do not count spelling on history, science, or other similar tests, allow alternative forms for book reports, permit the use of a laptop or other computer for in-class essays, use multi-sensory teaching methods, teach students to use logic rather than rote memory, and present material in small units. Dysgraphia is a specific learning disability that affects a person's handwriting ability and fine motor skills. It is the inability to write properly despite a student being given adequate time and attention. The cause of this disorder is still unknown, but is thought it could be due to a language disorder and or damage to the motor system. The main sign of dysgraphia is that a student's handwriting will barely be legible. The writing will appear incorrect or distorted and have letters of different size and space. The signs and symptoms of dysgraphia are: the person may have illegible printing and cursive writing, shows inconsistencies of writing, mixtures of print and cursive, upper and lower case or irregular size, shape or slant of letters, has unfinished words or letters, omitted words, inconsistent spacing between words and letters, exhibits strange wrist, body or paper position, has difficulty in pre-visualizing letter formation, copying or writing is slow or labored, shows poor spatial planning on paper, has cramped or unusual grip or may complain of sore hand, and has great difficulty in thinking and writing at the same time. Let me mention about the strategies for intervention. The educators and parents should suggest the use of word processor, avoid chastising the student for sloppy, careless work, use oral exams, allow use of tape recorder for lectures, allow the use of a notes taker, provide notes or outlines to reduce the amount of writing required, reduce copying aspects of work, allow use of wide rule paper and graph paper, suggest use of pencil grips and or specially designed writing aids, and provide alternatives to written assignments such as video taped reports, audio taped reports, and so on. Dyscalculia is a specific learning disability that affects a person's ability to understand numbers and learn facts of mathematics. It is a specific learning difficulty in mathematics. Like dyslexia, dyscalculia can be caused by a visual perceptual deficit. Dyscalculia refers specifically to the inability to perform operations in mathematics or arithmetics. It could be described as an extreme difficulty with numbers. Dyscalculia does not have the same stigma surrounding it, but it is very important to recognize it as soon as possible before it impacts on a child's self-esteem. Just as there is no single set of signs that characterize all dyslexics, there is no one cause of dyscalculia. Dys comes from the Greek word meaning difficulty with, calculia means calculations. Hence, dyscalculia means difficulty with calculations or mathematics. Signs and symptoms of dyscalculia. The person with dyscalculia shows difficulty in understanding concepts of place, value and quantity, number lines, positive and negative value, carrying and borrowing, has difficulty in understanding and doing word problems, has difficulty in sequencing information or events, exhibits difficulty in using steps involved in mathematical operations, finds difficult to understand fractions, feels challenged in making change and handling money, displays difficulty in recognizing patterns when adding, subtracting, multiplying or dividing, has difficulty in putting language to mathematical processes, has difficulty in understanding concepts related to time such as days, weeks, months, seasons, quarters and so on, and exhibits difficulty in organizing problems on the page, keeping numbers lined up, following through on long division problems. let me outline the strategies for intervention. The educators and parents should allow the use of fingers and scratch paper, use diagrams and draw mathematical concepts, provide peer assistance, suggest use of graph paper, suggest use of colored pencils to differentiate problems, draw pictures of word problems, use mnemonic devices to learn steps of a mathematical concept, use rhythm and music to teach mathematical facts and to set steps to a beat, and schedule computer time for the student for drill and practice. Dyspraxia is a specific motor difficulty that refers to problems with movement and coordination, whether it is with the fine motor skills or gross motor skills. It is also called as developmental dyspraxia or developmental coordination disorder. It is not certain what causes dyspraxia, but it is thought to be due to an immaturity in neuron development in the brain. Dyspraxia affects approximately 10% of the population, some severely. The overwhelming majority are male. Some people may be only affected slightly, but some others more seriously. Sometimes developmental milestones are delayed and there might be speech difficulties, and this, not surprisingly, leads on to difficulties at school. Often this problem is accompanied by difficulties in vision and movement. The medical journal defines dyspraxia as a serious impairment in the development of motor or movement coordination that cannot be explained solely in terms of mental retardation or any other specific inherited or acquired neurological disorder. While there is yet no known treatment for dyspraxia, regular physiotherapy and or occupational therapy may improve motor and coordination skills. Although the term dyspraxia is most often used in education, the Diagnostic and Statistical Manual of the American Psychiatric Association uses the term developmental coordination disorder and offers 5 criteria for assessment. They are: 1. There is a marked impairment in the development of motor coordination. 2. The impairment significantly interferes with academic achievement or activities of daily living. 3. The coordination difficulties are not due to a general medical condition. 4. It is not a pervasive developmental disorder. And 5. If developmental delay is evident, the motor difficulties are in excess of those usually associated with it. Let me mention about the strategies for intervention. Educators and parents should preset students for touch with verbal prompts. For example, the educator can say, "I am going to touch your right hand," before actually touching the student. They should avoid touching from behind or getting too close and make sure the peers are aware of this. They should provide a quiet place without auditory or visual distractions for testing, silent reading, or work that requires great concentration. They should warn the students when bell will ring or if a fire drill is scheduled. Whisper when working one-to-one with a child. Allow parents to provide earplugs or sterile waxes for noisy events such as assembly. Make sure the parent knows about what is observed about the student in the classroom and refer the student for occupational therapy or sensory integration training. Let me tell you about certain facts about the learning disabilities. A learning disability cannot be cured or fixed and it is a lifelong challenge. However, with appropriate support and intervention, people with learning disabilities can achieve success in school, at work, in relationships, and in the community. Learning disabilities influence the lives of children, adolescents, young adults, and adults. However, the way in which the learning disabilities are expressed may vary over an individual's lifetime, depending on the interaction between the demands of the environment and the individual's strengths and needs. Within all levels of schooling, students need to know how to explain their learning disabilities, support learning, and task completion. Without this self-awareness and the ability to appropriately self-advocate, the persons with learning disabilities are less likely to participate in post-secondary studies successfully. Let me discuss about the causes of learning disability. Factors that affect the brain are many and varied and include the effect of damage resulting from toxic substances such as drugs, alcohol, certain minerals, early deprivation, poor nutrition, and oxygen starvation. These can affect the prenatal, perinatal, and postnatal stages. Research has shown that a group of children with reading difficulties were products of pregnancies with complications such as toxemia, bleeding prematurity, and low birth weight. RH incompatibility, maternal endocrine disorder, maternal age, reproductive readiness, radiation, drugs, alcohol, tobacco, accidents, and anoxia were also reported to be conditions leading to learning disability. Children with post-birth trauma, head injuries, and lead poisoning which cause neurological damage, seizures, chronic ear infections, intracranial infections, and those children who inhale or ingest neurotoxins are likely to be affected by learning disability. Genetic factors seem to operate in large number of cases. Certain metabolic factors such as hypoglycemia, hypothyroidism, and so on are reported to be found in some children with learning disability. Children coming from economically and culturally backward homes may exhibit some characteristics of learning disability. Let me now discuss about the incidence and magnitude of this problem. The spectrum of difficulties and their severity makes assessment of specific learning disability extremely difficult, especially when they are confounded by environmental, cultural, and economic disadvantages. At present, in India, learning disability is considered to be the problem of a few in the big cities. Unfortunately, the confounding factors of English as a foreign language and lack of proper education and exposure which aggravate the academic difficulties of children also play a major part in masking the processing problems and make learning disability an elusive entity. Since difficulties with reading, writing, and mathematics are recognizable problems during the school years, the signs and symptoms of learning disabilities are most often identified during that time. However, some individuals do not receive an evaluation until they are in post-secondary education or adults in the workforce. Other individuals with learning disabilities may never receive an evaluation and go through life never knowing why they have difficulties with academics and why they have problems in their jobs or in relationships with family and friends. Let me explain the role of parents and educators in assisting children with learning disabilities. Parents and teachers should realize the power of a positive attitude towards children with a disability. They need to keep things in perspective and remember that their child's behavior is related to a disorder and the child's behavior is not intentional most of the time. They should believe in their child and make a written list of everything that is positive, valuable and unique about the child. The parents and educators should take care of themselves by seeking the necessary support of others in taking care of their children. They need to take a break between their daily routine activities related to their children. They should follow a routine and simplify the child's schedule. They should avoid problems by keeping the children with attention deficit disorder busy. Both the educators and parents remember to praise and give positive strokes to the children. They should also set clear rules and expectations. They may provide small meals more often, which may be helpful to the child. Parents should see to it that their child has a good sleep. Let me outline the assessment and testing process for learning disabilities. Assessment of a learning disability is a process which involves testing, history taking and observation by a trained specialist. Finding a reputable referral is important. Types of specialists who may be able to test and assess learning disabilities are clinical psychologist, child psychiatrist, educational psychologist, developmental psychologist, neurologist, occupational therapist, and speech and language therapist. Let me mention about the role of social worker with regard to children with a learning disability. The main role of social worker is that of care manager in a multidisciplinary team for children with a learning disability. The social worker should assess the need for community support services and commissioning services according to the criteria of eligibility, availability and cost, together with more direct support and counseling the children and their families. The social worker will have to take to multidisciplinary and partnership-based approach while working with the children. They need to work in a wide variety of services such as assessment, advice, advocacy, counseling, vocational guidance, or linking with community and other resources. Let me sum up. A child is considered to have learning disability if he or she has difficulty in communicating either expressively or receptively and cannot read, write or do mathematics within the range of criteria established as per school norms. There are certain types of learning disability such as dyslexia, dysgraphia, dyscalculia and dyspraxia. People with a learning disability can achieve success in school, at work, in relationships and in the community with appropriate support and intervention. Since difficulties with reading, writing and mathematics are recognizable problems during the school years, the signs and symptoms of learning disabilities are most often identified during that time. Parents and teachers should realize the power of a positive attitude towards children with a disability. They need to keep things in perspective and remember that their child's behavior is related to a disorder and the child's behavior is not intentional most of the time. Let me sign off now and hope to see you in another session. Thank you.